Okay, I think in view of time, we can start with the session. So,
Yes,
good
Lisa.
morning.
Yeah, you can begin.
Yes. Good morning, everyone. And on behalf of IPS Secretary Society, the Art and Culture Subcommittee, I welcome you all today morning for on a Sunday morning for today's topic, especially our Dr. Sudhir Bhavi sir, President, our Chairperson, Dr. Darpan Kaur, our esteemed speakers, whom we will be introducing subsequently, and welcome you to today's very interesting topic, I would say, theater and mental health. As we know that theater involves bringing a script to life through voice, movement, emotions, and presence. So, somewhere there is a link to mental health, I would say. So, without any further ado, I would like to welcome our president, but I think due to some internet issues, he is not able to join. But in case he joins in between, I will let you all know. Next, I would like to introduce our chairperson, Dr. Darpan Kaur, who is the person behind the Money Tarang concept. She's a professor of psychiatry, Department of Psychiatry, Mahatma Gandhi Mission Medical College and Hospital, Navi Mumbai. She's the founder and the consultant psychiatrist at Sadhguru Mind Care Mumbai and We Mind Mumbai. She's the chairperson of our subcommittee, and she's got the topmost leaders award in mental health, and she has keen interest in theater, and she integrates forum theater methods in various mental health awareness and anti-stigma campaigns. So I welcome you, Dr. Darpan Kaur, and over to you.
Yeah, thank you very much, Lisa, for a very wonderful introduction. And good morning, everyone. I'm traveling, and it is my esteemed honor as the chairperson to welcome all the esteemed speakers present in today's session of Money Tarang on theatre and mental health. And Money Tarang is an innovative webinar series which has been started by our Art and Cultural Subcommittee of the IPS Western Zonal Branch, which focuses on creating awareness on, culture, creativity, uh, psychiatry, and mental health. And we have done monthly webinars on various topics such as poetry and mental health, storytelling and mental health, music and mental health, dance and mental health, singing and mental health, photography and mental health. And this month we focus on theaters and mental health. We have three esteemed speakers in today's panel discussion on theater and mental health. The three speakers would be one by one sharing their thoughts on how this theater and mental health can be used as an innovative medium for mental health awareness. And after that, we will have a short panel discussion after all the three speakers finish sharing their thoughts. So it's my honor to welcome the first speaker. Uh, Lisa, can you please
Yes.
highlight the slide? Yes. So the previous slide, please. The previous slide. No, next slide. Next slide. Next slide. Just go to the previous program outline. Previous slide. Lisa, the previous slide before that,
The program
where
outline.
the three speakers' pictures are there.
Okay.
Previous slide.
Sure.
Yes. So we have three speakers with us today: Dr. Mary D'Souza,
No.
Gadge, and Dr. Samitra Nemlekar. So Dr. Mary D'Souza will be speaking first. So please share the screen of Dr. Mary D'Souza, ma'am. Can you please proceed to the CV slide of Dr. Mary?
Yes.
Yes. So we welcome Dr. Mary C. D'Souza. She's a professor and HOD at Department of Psychiatry, IPHB, Bambolim, Goa. She's been working in IPHB Goa for past 24 years and currently as professor HOD since Feb 2025. She's PG Psychiatry Guide since 2013 of Goa University, has authored several research papers in national and international journals. She has keen interest in women and child psychiatry, prison psychiatry, and geriatric psychiatry, is a national trainer on mental health, neurological, and substance use disorders module under Ayushman Bharat HFW Government of India, and she's also master trainer in psychosocial care in disaster management under the Ministry of Health and Family Welfare, Government of India. So over to you, Mary ma'am. We'd really love to listen to your insights on this very important topic on theatre and mental health. So welcome you, ma'am. Over to you.
Thank you, Dr. Darpan. Okay, a warm good morning to all of you. Actually, I'm sure this is a very busy Sunday morning for everybody, looking at the list of participants who are there. But yet, I think the art and culture group has come out with this wonderful topic of theatre and mental illness. And I couldn't refuse to, come and say a few words about it. Though I'm not an expert, please understand that first and foremost. What I would be talking about is just some of the mental health benefits which one can look forward to when you're associated with theatre. Okay. In today's day, the significance of mental health has never been more pronounced as we navigate an increasingly complex world. Finding effective ways to support and improve our mental health well-being is paramount importance. One such method that has stood the test of time is theatre, and the mental health benefits of theatre are profound and multifaceted, offering a unique blend of social, emotional, and psychological advantages. So let me list out at least a few of the mental health benefits which we can come across while we are doing theatre. The most important one, I think, which I think all of us will appreciate, is the emotional expression and release which takes place when we are a part of a theatre company. So one of the most immediate mental health benefits of theatre is its ability to provide an outlet for our emotional expression and release. Whether you are an actor, whether you are a director, whether you are just an audience member, theatre will always allow individuals to explore and express a wide range of emotions in a very safe and supportive environment. Now, this emotional catharsis can be incredibly therapeutic, helping individuals process their own feelings and experiences through characters and stories that they engage in on stage. Another very important mental health benefit of theatre is like how we go around building empathy and understanding others. So when we are engaging with theatre, whether by performing or by watching, this will foster empathy and understanding. By stepping into the shoes of different characters and exploring diverse narratives, individuals can gain a deeper appreciation of other people's perspectives and struggles. This enhanced empathy is one of the significant mental health benefits of theatre, as it will encourage a more compassionate and connected society, reducing feelings of isolation and promoting a sense of belonging. One more thing which really is a plus point for theatre is the cognitive stimulation which will take place. Mental health benefit of theatre extends to the cognitive stimulation. How? By learning the lines or understanding the complex narratives or engaging in a very improvisational exercise, which is a very big challenge to our brain, which will help it to become very active and engaged. Especially for the older adults in particular, this cognitive stimulation can be beneficial in maintaining mental acuity and potentially delaying the onset of cognitive decline. So theatre encourages continuous learning and mental agility, contributing to overall mental health wellness. Theatre also brings in a sort of a social interconnectedness. A community bonding can also take place. Very, very important. Participating in a theatrical production requires collaboration and teamwork, which can help build stronger social bonds. For many, theater groups become almost like a second family. Like they will provide support, friendship, and a sense of belonging. These social connections are vital for mental health as they can alleviate feelings of loneliness and provide a network of support during challenging times. One more very important benefit of theater is boosting of self-esteem and confidence. Theater significantly boosts self-esteem and confidence. This is another very strong, important mental health benefit. Taking on a role or a responsibility and then successfully performing it in front of an audience can be an incredibly empowering mechanism. It allows the individual to step out of his comfort zone, overcome his stage fright, and achieve personal growth. This newfound confidence often extends beyond the stage, positively impacting other areas of life, including his work relationships and his personal development. Mentioning a little bit about the therapeutic use, like the drama therapy, the mental health benefits of theater are also harnessed in therapeutic setting through techniques like drama therapy. The drama therapy uses theatrical techniques to promote mental health and physical growth. It can help individuals express themselves, explore their emotions, and work through certain personal issues in a very structured and supportive environment. So, drama therapy has been used to address a range of mental health issues like depression, anxiety, trauma, grief, demonstrating the profound therapeutic potential of theater. I'm sure my next speaker is going to talk a lot more about drama therapy. Another very important, benefit of theater is how we can practice mindfulness and presence while we are on stage. So engaging in theater requires a high level of mindfulness and presence, which are very, very beneficial to our mental health. Actors must be fully present in the moment. They have to respond to their fellow performers and the unfolding of a narrative which takes place on stage. This focus on the present moment can serve as a form of mindfulness practice. It will help individuals reduce their stress, improve their concentration, and enhance their overall sense of well-being. The mental health benefits of theater in promoting mindfulness are particularly relevant in today's fast-paced and often stressful world. The next benefit is about the cultural enrichment and personal fulfillment which we get when we are doing theater. So it offers, being part of a theater production allows the individual to explore different cultures, histories, stories, enriching their understanding and appreciation of the entire world. Now, this cultural engagement can prove a sense of purpose and it will provide a sense of purpose and fulfillment, enhancing the overall mental well-being. The joy and satisfaction which is derived from creating and sharing art can be a powerful antidote to stress and anxiety. One more important benefit which we can get out of theater is that it helps in creating safe spaces for difficult conversations. Theater often tackles challenging social issues, providing a platform for discussion and reflection. By addressing topics such as mental illness, addictions, discrimination, and inequality, theater can raise awareness and promote understanding. So this can lead to a greater empathy and support for those struggling with these issues, fostering a more inclusive and a supportive community. So to conclude, I would say mental health benefits of theater are extensive. They will encompass the social expression, emotional expression, cognitive stimulation, social connection, and even personal growth. So whether through participation in a production or attending a performance or engaging in drama therapy, individuals can experience profound improvements in their mental well-being. Theatre's unique ability to combine art, emotion, and human connection makes it an invaluable tool for fostering mental health in our modern world. So, as we embrace mental health benefits of theatre, we will open ourselves to a world of empathy, creativity, and connectivity, enhancing not only our well being, it will also enrich the lives around us. So, whether you are a seasoned actor or an avid theatre goer or someone who's new to the world of theatre, mental health benefits are within reach, waiting to be discovered and experienced. So with that, I wind up my presentation. Thank you.
Thank you.
thank
Dr.
you.
Over to
Mary,
you.
ma'am. I would just like to thank you, Dr. Mary, ma'am. I was always admiring the way you used to strongly advocate art and culture, including drama in the Goa Medical College, ma'am. So it was really nice to have you explain all its benefits. Very informative. Yes, Dr. Darpan.
Yeah, thank you very much, Dr. Mary D'Souza, ma'am. It is very wonderful listening to you on Sunday morning, and we got very, very nice, creative insights, and your talk was very nice and refreshing. And thank you so much for being part of this series. If you can stay back, ma'am, for another 15 minutes, then we can complete the speaker talk by 11:30 and just have a 10 minutes panel discussion and try to close it by 11:40. Lisa, would that be fine?
Yes, Dr. Darpan. Fine. Dr.
It was a pleasure being part of the group, but I don't think I will be able to stay on more because
no problem, no problem,
some prior commitments. Yeah. So
No
kindly
problem, no
excuse
problem.
me. Thank you so
Yeah.
much.
Thank you so much, ma'am. Bye bye. Good
Thank you so much.
morning. Have a great Sunday. Bye. So we have our next speaker now. We welcome Dr. Rahul Gadge. He's a consultant psychiatrist with 20 plus years clinical experience. He practices at Masina Hospital, Mumbai, Wockhardt Hospital, Gleneagles Hospital, Mumbai. His areas of interest are adult psychiatry, addiction and rehabilitation. He's actively involved in mental health awareness as he aspires to move towards emphasizing mental health and work together to create an empathetic and perceptive community. Also, he has interest in theatre and Marathi movies. So it's an honor to welcome Dr. Rahul Gadge. Over to you, Dr. Rahul.
Yeah, thank you, Darpan. I really appreciate, Darpan, that you are traveling and still you are there with us. Thank you. So, good morning, everyone.
Good morning, Dr. Rahul.
Good morning. Good morning. I strongly believe that being psychiatrists, we are involved in mental health awareness activities either directly or indirectly. And you all know that media is the easiest and you can say easiest tool or platform to reach out to the masses, and so do the dramas. But dramas have got some different quality. When you are watching drama, you are really something like a unfolding of real life experiences. It is something like something is really happening around you. You are engrossed into it, and then you get connected very easily. So I would say drama is something having something like impact, promising impact. Yeah, that's the right word, promising impact. So today I'll share with you some Marathi dramas. Marathi dramas like having mental health at its core content. Okay, I mean they are so though they are in Marathi, but still I would explain the story concept in English so you all can understand and you can agree with me that drama is the really effective tool for the mental health awareness. Yeah, so the first one is Ekas Pyala. Thank you, Lisa. So Ekas Pyala, Ekas is the only, and Pyala is pig. So it means the only pig. So this movie, this drama, I'm coming with movie only. So this drama was written by Mr. the most respected Maharashtrian author, that is Ram Ganesh Gadkari, and that too way back in 1916. Yes, man, 1916, 100 years ago, more than 100 years rather. And it was staged in 1920. Yeah, I remember that. So this 100 years old masterpiece depicts devastating effects of alcohol. The main character is lawyer who succumbs to alcohol grief, descends into psychotic episode, tragically kills his only son, and later falls into post-psychotic depression to kill himself. Isn't it thought-provoking portrayal of substance abuse and its far-reaching ill effects? Yes, and that is what author Ram Ganesh Gadkari is. Thanks to Gadkari ji, is truly commendable. And second is Sanshay Kallol. Next slide. Yeah. Thank you, Lisa. Sanshay Kallol, it means turmoil due to suspicion. Again, it is authored in 1920 by Govind Balla Deval. He is also Maharashtrian author. It is very funny but humorous portrayal, s- sending a message of mental health awareness. It depicts conjugal paranoia, that is infidelity. So this is about Sanshay Kallol. There was one day event in Pune organized by NGO called as Parivartan. This NGO being founded by our late Dr. Narendra Dabolkar, and now this NGO is being looked after by our colleague and his son, Dr. Hamid Dabolkar. On the occasion of that event, he said that mental health is not only about disorder, it is not only about disease, but it's a process everyone undergoes through. And he had adds to it that drama can be the effective tool for the mental health awareness. Rightly said. So there were three dramas in that event. The first one was न केलेल्या नोंदी, that is being unregistered, by Sachin Shinde from Nasik. Second is Rangit Sangeet Gondha by Abhijit Sunjara from Kalyan. And third being Ek Rajahansato by Kshitish Date from Pune. So particularly talking about Ek Rajahansato, it narrates importance of mental health among farmers. What are their demands, how their demands being ignored, how they succumb to mental health disorders and the suicide ultimately. So these are the few dramas I shared with you. You must watch. So dramas can be looked upon as a effective tool for the mental health awareness. Dramas have already paved the way for the mental health awareness. Let's take this conversation further. Let's be together and bonded for the mental health awareness and to break the stigma with the help of the dramas. Thank you.
Thank you, Dr.
And
Rahul Gage.
thank you, IPS West Zone Culture Committee. Thanks a lot.
Thank you for the thought-provoking session.
It was a very short one, I agree, but I really wanted to share some Marathi dramas with you all people. That's what my goal was, and I did
Very
it.
thought-provoking, sir. Over to you, Dr. Darpan.
Yeah, thank you very much, Dr. Rahul. It's very wonderful listening to you, and you brought in very nice insights about, Marathi theatre and the different, dramas that have had so much implications for community mental health awareness. So it has been a very nice and, brief listening to you, but it's very insightful and very creative. And thank you for, speaking on this topic on theatre and mental health awareness. So, Dr. Rahul, if you can stay back for 10 minutes, 5 to 10 minutes more, Then we will finish with the third speaker. And if Lisa would like to moderate for 5-10 minutes, if audience wants to ask any question, we will have a quick 5 minutes Q&A and complete it. So we request Lisa to please share the CV slide of the third speaker. Lisa, can you see?
Yes,
Yes.
just one
Yes.
second, just. Yes.
Okay, we welcome the third speaker, Dr. Soumitra Nemlekar. He's consultant psychiatrist with 10 years plus clinical experience, currently working at Baba Atomic Research Center, BRC Hospital, Mumbai, as scientific officer consultant. He is the DNB faculty. He earlier practiced in Surat and Goa, has many publications in various national journals. His key interests are in theatre and participated in some plays. So we welcome you, Dr. Soumitra Nimlekar. Over to you.
Thank you, ma'am, for the kind introduction. Good morning to all the participants, and thank you, Darpan, ma'am, for giving this opportunity, and especially Dr. Lisa, who approached me for this topic. I would like to begin with having an understanding of how theater has come about. So we all understand that theater has always been an art form. Now, from available literature, we understand that theater has, written recorded evidence of beginnings as early as in the Greek society, wherein it was actually Aristotle who kind of gave the concept of theater. And when he says something of theater, he feels that in a theatrical form of art, there has to be 6, 7, I would say, important key points in order to convey an information. And he says that it should have a plot, it should have a character, it should follow a thought, and that thought should be conveyed through diction with a melody, and at the end there should be spectacle. And his work began with like how we now understand as catharsis, wherein he called it as a purging effect, is to purge the emotions of fear and whatever kind of stigma that people had about certain emotions. So that is the beginning of theater, and over time theater was adapted into mental health, and it has been used in order to give a platform for various ideas. And like my previous speakers have spoken, there is undisputed role of theater in propagation of information. One thing that is important in understanding theater and its use by us as psychiatric professionals is that it is metaphorical, and we can talk about a lot of things that we would not be usually able to speak in common interpersonal communication. And this information can be used to educate people. Now, like Dr. Rahul said, that we all should be informing people, and we are all educationists when it comes to relieving stigma. The one thing in theater that is kind of unique when giving information is that it happens in a setting that is acceptable to the community. That is, by theater as a form to inform people of mental health is in a setting that is acceptable for people, and it engages people, and it is something that has been proven to be more easier forms to approach a crowd or a group of people who can understand a topic which is maybe technical or scientific and can be modified in a very beautiful storytelling form for anybody and everybody from all strata of the society. So, like Dr. Rahul said about the Manas Rang festival, there have been various other endeavors in India in order to understand regarding theatre and use of theatre. So we we know about the Scarf Group in Chennai, which has been using the theatre as a tool to propagate mental health, in which they have used a Brazilian author's principles of theatre of the oppressed, in which he has advocated that those individuals who are living with mental illness and those who have issues then can themselves come on stage and share their experiences regarding psychosis and performing their real life stories to help people understand that the difficulties that they have. Similarly, internationally in the UK, we have got something that's known as a common play known as Next to Normality, which helps people educate and learn about bipolarity. And from India, we have another group that is known as Mental Health Literacy Project in Kerala, which also uses theater-based intervention. So some of the plays Dr. Rahul has recently told, but I happened to see one play by Dr. Shweta Pendse. It was also Marathi play known as 38 Krishnavila, in which the story is regarding plagiarism, but the author, I mean, the writer has beautifully kind of encapsulated all the symptoms and features of social anxiety disorder, which becomes a kind of a central theme around the play. There have been other noteworthy plays which is written by Abhijit Junjar Rao, which is Lazim Kharinara Pura, which talks about farmer suicides, which has talked about certain communal incidents. So plays have always played a role in order to, or theater has always played a role to talk about things that we don't usually kind of talk about. We have got immense great playwrights and the Manasarang Festival has also been working. Dr. Hamid Dabalkar has been working to use theater, and some of the other noteworthy plays are Pokal Vasa, Astitvachi Khichdi, which all talk about various illnesses. So now, just to kind of understand what kind of written literature is available. So we have a lot of studies on psychodrama and drama therapy by Auricobi et al., which talks about use of theater in adolescents and in young people in reducing symptoms of anxiety. Similarly, there is a lot of work by Daisy Fancourt in the UK with using theater in helping mental health and social loneliness and problems in elder population. Then trauma and theater has been used in refugees for reducing the symptoms of PTSD. And a Lancet study says that people who have got information about mental health tend to learn a lot about stigma, illness, and particularly in topics revolving schizophrenia and depression. In our books and literature, we already know as scientifically psychodrama was one of the purported ways of therapy. So, in order to just summarize, I would like to just say a few things about how theater and mental health can work together. First of all, is what Madam says, Dr. Mary Connie D'Souza said that it is a tool for emotional expression in order to propagate ideas. And secondly, it has a proven role in stigma mitigation and advocacy for mentally ill rights, and also to kind of provide a culturally representative form of information to the masses. And further research needs to be done. It does have limited role in treatment and therapy outcomes, but definitely in mental health advocacy and in psychoeducation, it definitely has a role. And with this, I conclude my talk, and I thank all the office bearers for giving me this opportunity. Thank you so much.
Thank you, Dr. Soumitra, for that very informative session. It was very, to have a better understanding, a little more about, what drama does in those examples, in addition to what Dr. Rahul said. So thank you for that.
Yeah, thank you very much, Dr. Soumitra. It's a very nice session you have conducted, and you've given brief points, but they are very relevant. And I'm sure that everyone who's listening to this webinar on theater and mental health will get some creative insights, and they can also plan further role plays and activities around mental health weeks and days of significance, incorporating skits, plays, and theater and mental health awareness. So with this, Lisa, I just request you if you can spotlight the three speakers, if Mary Ma'am also is available, yourself and myself, and just do a quick 5 minutes Q&A, and please complete it by 11:45. Thank you.
Sure, Dr. Darpan.
Shall I speak?
I'm the odd person out.
Ma'am, Dr. Saranya, ma'am.
Okay.
We'll start a moderation in just a minute, just sharing the screen, and I'll invite you, ma'am, to speak. Let me just.
Click the three
Sunday,
dots beside
Sunday
the name.
morning, so I have not put the video on.
Yes, yes.
I will only
You
speak.
can click the three dots beside the name, and there'll be spotlight for everyone. You try it, Lisa, for 1-2
Yes.
minutes. If you're not possible, then just go ahead with this format only and complete it.
That's all. Because
Sure,
anyway, I
sure.
have not put my video.
No, Dr. Saranya, ma'am, I'm just trying to share the screen. That's what she's saying. Just give us a minute, ma'am. Just. Is it visible now, everyone? Dr. Darpan, ma'am?
No, not yet.
No, not yet visible.
Okay. For some reason, actually, our technical expert could not be there. Just excuse me and give me a minute. Let me.
Lisa, if you're not able to do it,
Yes.
fine. We could just go ahead like
Yes.
this.
We'll
No
go
problem.
ahead.
You can
Yes. Yes.
ask
Yes.
your one question to
Sure.
both the speakers, and then quickly we'll close it. Okay, thank you.
Sure. Yeah. Thank you. Yeah. First to Dr. Rahul Gadge, sir. Thank you for that really thought-provoking session. Do you think, sir, I mean, have you seen any instances or know any patient where you think drama therapy probably helped them, or there were any challenges because they were involved in dramas? Any experience, sir?
Honestly speaking, like I have not used drama as a tool for the awareness or for the psychoeducation so far. Not experienced, but yes, I'll try to now. After this session, I am really thinking about that I should use this as a tool for the psychoeducation.
So it is promising, no, sir. That's what
Yes,
you
yes,
would like to
yes,
say.
yes.
I mean, it is
So far,
very.
it was restricted to me only. I was only using drama as a tool for the psychoeducation. How can talk to the patient about how can I give some examples from the dramas to the patient? But I'll make patient to they should actually go through the dramas and watch the dramas only for the psychoeducation, particularly about psychiatric disorders.
Couldn't agree more, sir. Thank you for that. Dr. Soumitra, yeah, this question is
Yes.
for you. Thank you so much for that informative. So you mentioned about adolescence and child, there was some drama. So is it a drama club that they were having, or is it just like a research they had?
No, it was a research-based kind of a thing. Actually, I'm
Okay.
not able to exactly remember what it was,
Okay.
but they have tried to understand and educate the adolescents about anxiety and depression. It is
Okay.
not more of therapeutic, but not an intervention kind of a paper, but it is about understanding about anxiety and depression in adolescents, and they're helping them learn and educate more.
So do you think it'll help us more if we try to advocate it at that stage? I mean, especially children. I mean, today everyone, all the speakers, you all have highlighted nicely how mental awareness, increasing self-esteem. Do you think it'll help, like having this on a more larger scale? Any thoughts on that?
Yes, I think it may help. Like for example, when I was doing my residency in GMC Surat, my HOD Dr. Ritambara had kind of written a play on Ullu Undar no Anjam. It is Gujarati, meaning that we had kind of shown alcohol dependence and how the individual or it was kind of Undar means rat in Gujarati. So we had kind of enacted before me. My seniors had enacted a play, and we had a recording. And whenever we used to have for under DMHP the training of Anganwadis and all, we would show that to the small film to the individuals. And there were other movies also in which movies is in theater form in which we had tried to kind of educate people about mental health. So I am an advocate of using theater as a form because I feel many times when we speak to patients and we speak to the group of people, I feel that hello, I think, yeah. I feel that, like I said, the community participation is much better when information is given to them in a medium that is much more acceptable rather than purely a didactic form. So I think theater, like my previous speakers have talked about, clearly encompasses a lot of various ways. Along with catharsis, what it does is that it also helps people understand perspectives in situations which may be relatable. So I think theater may be useful as a form in order for mental health, not mental illness, but at least information and knowledge about mental health. In adolescence, I feel that it could be used to kind of, have their interpersonal issues that normally occur in adolescence to be shown to them in a theater form. So we already know about psychodrama, which is having a similar base in which we have people enact or try to practice more positive or more effective ways of coping strategies in any of such issues.
I couldn't agree more with you, Dr. Samitra. I mean, on a personal aspect, I know because my kid in school they started these drama clubs, and I noticed a difference. Even things like self-esteem increasing, the self-confidence makes a big difference. So I think that's a really nice thing that some of the schools are starting. So I couldn't agree more to that. Yeah, thank you, Dr. Samitra. I think Dr. Saranya ma'am, you wanted to ask something, ma'am? Say
Nothing.
something.
I didn't want to ask. Simply, I wanted to add, though
Sure,
it is
ma'am.
all
Yes,
zone.
please.
It is the similar things are happening even in any other thing, and even vernacular dramas of yesteryears as well as recent years are very, very useful, which is very similar dramas, whatever has been told by the second speaker, happen even in Tamil Nadu, in Tamil, this one. So, natural for us to express all our feelings, not only educating the public, even to express the public, to make them feel, empathetically with the character, it is very, very useful. I'm not talking about serious dramas now. I'm talking about small street plays and small role plays, which are very, very educative, and very much we should be using it in all the things. I use it for training the counselors, training the lay counselors, as well as training professional counselors. Even sometimes I train the local healers and all those exorcists and such people. I use them like a role play or like a street play. If it is a little group, even police personnel, to make them aware of what all mental illness they are there, how mentally ill has to be treated, how they have got a right for treatment. Most of these things can be done very easily with street plays or with role plays. Role plays at an individual level, at a group level, street plays. Then talking about our own burnout, yes, we do have, during COVID, we have produced quite a lot of dramas ourselves, each one's playing the role and all those things. Like that, we should put on inside a psychiatric society. We do have certain awards for small short plays or some short movies which are taken for many of things, which is for mental health professionals, for our own, to prevent burnout. Thank you.
Thank you for sharing that, sir,
Yeah,
Dr.
agree
Saranya
with
ma'am.
Lisa.
Yes,
I would
thank you,
add to it.
Lisa. Lisa, as chairperson, it's a quick reminder. It's 11:45. So, Rahul, just quick 1 minute and we have to close it.
Yes, yes, yes.
Yes.
That reminds me, Saranya Madam said about flash mob, sorry, about skit. Yeah, skit can be used as a very effective tool. I have used that skit like for the schizophrenia awareness. We have gone to the slum areas also and make the people aware what is schizophrenia through the skit in a very effective way. It's very easy way to connect with the people, with the general population. The same with the flash mob also. Flash mob through with the use of some songs, we can connect with the people and tell them what is the importance of the mental health. I agree with that.
Thank you for sharing that, Dr. Rahul, sir. Dr. Darpan, would you like to add some of your...
Yes, so as the chairperson, I just like to give the concluding remarks. I'm traveling in just about to, a quick 1 minute, and then Lisa can propose. Dr. Alkesh is there, he can give the word of thanks as a convener. If he's not there, Lisa can give the word of thanks. So I just want to thank all the speakers, Dr. Mary ma'am, Dr. Rahul, and Dr. Soumitra. You have taken out your valuable time on today's Money Tarang webinar on theatre and mental health. You all have shared very nice insights, and thank you, Dr. Saranya, also for a very good, point that you've raised and shared for small role plays and skits. Very well taken. And thank you, Dr. Lisa. You've been a wonderful moderator, and congrats to you all the hard work that you're doing as a member of the IPS Art and Cultural Committee. We appreciate your hard work, and thanks to all the speakers who today took out their time to share their valuable insights. So we have to close it. And Lisa, over to you for your word of thanks. Thank you.
Thank you. I just want to, end with the stage has been long a mirror, not just of society, but of the soul. Okay. Yeah. So I would like to propose the vote of thanks as Dr. Alkesh would not be able to make it. So on behalf of IPS Secretary Society Art and Culture Subcommittee, I would like to thank our President, Dr. Sudhir Bhave, sir, our Secretary, Dr. Vijit Faye, our Chairperson, Dr. Darpan Kaur, and our esteemed speakers for today for enlightening us and giving this thought-provoking session so that we go back and try as much to implement as well as understand drama more. So thank you for that, and also our audience and Dr. Saranya ma'am for your insights.